There is this incredibly pervasive phrase that adults use whenever a child goes through a massive upheaval.
Oh, yeah.
We say it so often that it's basically become a cultural reflex. I mean, we say, well, kids are made of rubber, they bounce back.
Right. It is this assumption of automatic resilience.
Yes,
We
exactly.
assume that just because they are young, their brains just effortlessly adapt to whatever environment we drop them into.
Exactly. But if you actually stop and think about it, we do not apply that logic to anything else. Like if an adult gets relocated for work, they get relocation packages, onboarding grace periods.
Sometimes even executive coaches to manage the transition.
Yeah, literally.
Right.
But when we uproot a child, when we move them to a new city or a totally different school district, a brand new social ecosystem, we basically just cross our fingers.
We do.
We point them toward the cafeteria and expect them to thrive instantly. And if they don't, we are surprised. We completely dismiss the emotional toll of that transition.
It is a huge blind spot.
And that is exactly what we are focusing on today. Welcome to this deep dive. We have a very specific mission for you today. We are dismantling this pervasive myth of the resilient child during big life transitions.
It is a crucial conversation.
Yeah.
Because the gap between what society expects of kids and what they are actually experiencing internally during these transitions is, frankly, massive.
To get to the bottom of this, we're looking at a stack of incredibly timely source material for you. We have got a comprehensive briefing on K-12 mental health support, right alongside some deep clinical insights into youth transition stress.
Yeah, the clinical data is really revealing.
We're going to look at the factual reality of what happens to a child's brain under this specific type of stress. And then we're going to explore a massive systemic solution that is currently rolling out across K-12 schools in Georgia called MentalSpace.
Which is just a fascinating look at how a massive bureaucracy is attempting to solve a deeply personal psychological crisis at scale.
Okay, let's unpack this, starting right at the individual level. Because before we can even look at how schools are trying to treat the problem, we really have to understand what the problem actually is.
Right.
So let's talk about that societal refrain again. Kids are resilient. They will bounce back from a move.
It is a very comforting thought for adults, isn't it?
Totally.
I mean, it absolves us of worry, and frankly, it absolves us of having to do the hard work of emotional support. But the clinical insights in our sources paint a very different factual reality.
What do you mean?
Well, when a family relocates, or even just when a child transitions to a new school across town, they aren't just changing a zip code or a bus route. They are experiencing a profound, often traumatic loss.
Right.
It is the sudden loss of familiar faces, the evaporation of ingrained routines, and, most importantly, the complete destruction of their sense of belonging.
And for a kid, especially a middle or high schooler, I mean, that sense of belonging isn't just a nice to have, it is their entire world. It is knowing exactly who you were going to sit with at lunch so you aren't humiliated. It's knowing the unspoken rules of the hallway, right?
The social currency.
Exactly. Knowing which teachers are lenient and which ones are strict. When you strip all of that away overnight, it is a severe shock to their system.
Precisely. That loss is a severe psychological blow. And the sources detail exactly how this manifests within the first few months of a transition.
And it's not pretty.
No, it's not. We aren't just talking about a kid being a little quiet at the dinner table. The clinical documentation shows profound sadness, deep worry, and intense irritability.
Wow.
Physiologically, you might see trouble sleeping or sudden changes in eating habits. Cognitively, there's a severe difficulty focusing on schoolwork.
Because they're just overwhelmed.
Right. And socially, they might pull away from the few friends they do have, or, in many extreme cases, they start outright refusing to go to school at all.
What's wild to me is how easily those specific severe symptoms get written off by adults as just bad behavior. Like a kid is incredibly irritable or won't eat, and the adult looks at them and thinks, oh, they are just acting out. They're just being dramatic. We misdiagnose grief as defiance.
What's fascinating here is that the clinical community has a very specific, objective term for this exact phenomenon.
They do.
Yes, this isn't a child being dramatic. This is a clinically recognized condition called an adjustment response.
Adjustment response.
It is a documented psychological response to overwhelming environmental stress. It is not a character flaw. It is not bad parenting. It is a neurological condition that requires understanding and intervention, not punishment.
I really want to push back on how society handles this because it drives me crazy when I read these sources. Telling a kid who just lost their entire social ecosystem, who is deep in an adjustment response, that they're just being dramatic.
Right.
Or that they just need to tuck it out. I mean, it is like watching someone get a stress fracture in their leg while running a marathon and telling them they are just faking a limp.
That is exactly the dynamic. You are demanding they walk normally on a broken foundation.
Right. If someone has a stress fracture, you do not say, well, walk it off, bones are resilient. You give them a boot. You give them physical therapy. You acknowledge the injury.
Yes, you treat it.
So my question is, if this adjustment response is a legitimate, recognized clinical condition, how do we actively fix it? Because if a kid is refusing to get out of bed, we can't just cross our fingers and wait for time to heal the wound, right?
No, we absolutely shouldn't wait, because waiting often allows the acute stress to calcify into long-term anxiety or depression.
Oh, wow. Okay.
And the clinical toolkit detailed in our sources provides a very clear, actionable treatment plan. When a child is dealing with a severe adjustment response, the gold standard intervention mentioned is short-term, culturally responsive cognitive behavioral therapy.
So CBT.
Exactly, CBT, along with supportive family therapy.
Okay, I want to pause and really break that down for you listening, because CBT is an acronym that gets thrown around a lot in pop psychology.
It does.
But how does that actually help the specific kid who is having a panic attack about walking into a new cafeteria? Like, what are the actual mechanics of this therapy?
Well, it works by addressing the mechanics of the child's internal distress. When everything in a child's environment is new and overwhelming, their internal experience is just chaos.
Right.
Their brain is firing off warning signals constantly.
Right.
CBT doesn't just ask them how they feel. It actively helps kids identify the connection between their thoughts, their feelings, and their behaviors.
So it's cognitive restructuring.
Exactly. Therapy provides the framework to say, okay, your thought is, everyone here hates me.
Yeah.
That thought leads to the feeling of terror. That feeling leads to the behavior of putting your head down on the desk. Once the therapist helps the child map that out, they can start challenging those automatic negative thoughts.
That makes a lot of sense.
They give them the vocabulary to say, I am not just angry. I am grieving my old life. Or, I am terrified of being rejected here. Once they can name the mechanism, the therapy shifts to helping them build actual strategies to rebuild connections so they can begin to feel at home.
And the sources heavily emphasize that a licensed clinician is absolutely essential here. This isn't something a well-meaning guidance counselor can just chat them through in 15 minutes.
Completely essential. Because you need a clinical professional to properly diagnose if the stress is indeed an adjustment response, or if it is masking something else entirely.
Like what?
Like a previously undiagnosed learning disability or clinical depression. The care has to be fitted to the specific child's psychological profile.
That makes total sense. But I want to zero in on one specific, very important phrase you use from the text.
Sure.
Culturally responsive therapy. Because moving isn't just about changing geography. It's often about navigating entirely new cultural expectations.
Yes. The cultural context of the move is everything.
Think about the real-world application of this.
Yeah.
If a kid moves from a deeply tight-knit rural community where everyone goes to the same church and knows each other's grandparents,
Right.
and suddenly they are dropped into a massive, fast-paced, highly competitive urban magnet school in Atlanta, it is a massive culture shock. Providing culturally competent care means the therapist actually understands the specific, nuanced world that child is walking out of and the one they were walking into.
And that is exactly why the sources specifically mention the need for licensed, diverse therapists who are culturally competent.
Right.
If a therapist tries to apply a one-size-fits-all approach and doesn't understand the cultural nuances of the child's background, whether that is racial, socioeconomic, or geographical order, the therapy simply won't connect.
Because they don't get it.
Right. The child will feel like they have to translate their existence to the therapist rather than just receiving help. They won't feel seen.
Right. So we know individual therapy with a culturally competent professional is highly effective. The clinical mechanics work. But this brings up a massive, glaring logistical problem for K-12 education. Yes, how do you scale that? How do you reach every single kid going through a tough transition in a school system of 50,000 students? You can't just hand the parents a pamphlet and hope they figure out how to find a private, culturally competent therapist on their own time.
If we connect this to the bigger picture, this is exactly where the systemic shift is happening.
Okay.
This is the transition from individual problem solving to a massive ecosystem solution.
Yeah.
And in our sources, that solution is the MentalSpace school model currently rolling out in Georgia.
This program is huge. Let's really dig into the features of what MentalSpace is actually doing because it completely redefines what school support looks like.
It really does. First and foremost, the cornerstone of their program is providing same-day teletherapy.
Same day. Let me just be a little skeptical for a second because that sounds almost impossible.
It does sound like a lot.
Usually, if a kid is in crisis, they get put on a community health waiting list for 6 months. How does a 14-year-old actually get same-day teletherapy during third period in a crowded high school?
It is a great logistical question. The way they solve it is by assigning dedicated therapist teams to each specific school.
Oh, I see.
So the school isn't just calling a random outsource hotline where they wait on hold. They're connecting with a dedicated team that already knows their student body.
That is smart.
The schools set up private spaces like dedicated wellness kiosks or private rooms where a student can go during the day. The student logs in, connects with their dedicated team, and receives care immediately without missing an entire day of school to travel to an offsite clinic.
That is incredible infrastructure. So they are effectively building digital clinics inside the physical schools.
Essentially, yes.
And the text notes, they also handle immediate crisis intervention, as well as proactive suicide and violence prevention.
Exactly. It is an incredibly ambitious scope. They are moving from reactive discipline to proactive mental health care.
But there is one detail in the text about MentalSpace that really caught my eye, and I think it is the secret sauce to the whole thing. It says the program includes staff wellness and family counseling.
Yes. It takes the focus off treating just the individual student in a vacuum.
And I think that's brilliant. I was trying to think of how to explain why this matters so much. Trying to treat a stressed out child without supporting the teachers who see them every day or the parents who go home with them every night.
Right.
It's like trying to purify the water in a fish tank while completely ignoring a dirty filter.
That is a perfect analogy.
You can chemically treat that water all you want. You can put the fish in isolation, but if the filter is clogged, the minute you put the fish back, the environment stays toxic. The whole ecosystem needs care.
That ecosystem approach is the only way true prevention works. Think about the mechanics of a classroom. If a teacher is completely burning out, dealing with their own unregulated stress,
Which happens all the time.
right, they physically cannot co-regulate a child who is having a panic attack about a recent move.
Wow, yeah.
If the family is deeply stressed about the financial implications of a relocation, that anxiety bleeds directly into the child's morning routine. MentalSpace, recognizing that staff wellness and family counseling are integral to K-12 student mental health, is a massive leap forward in clinical thinking. You cannot separate the child from their environment.
Here's where it gets really interesting now. Building an ecosystem, this ambitious, deploying teletherapy pods, hiring dedicated clinicians, counseling teachers, it requires serious infrastructure.
And funding.
Yes, it requires funding. It requires navigating legal landmines. And usually it requires a massive catalyst to actually force schools to adopt it. And our sources reveal a ticking clock for this initiative.
The legislative mandate.
Yes. The briefing explicitly mentions HB 268 compliance support with a very specific deadline. July 2026.
Right around the corner.
Exactly. Now, for you listening, let's put this in context. Right now, today, it is mid-July 2026. This is not some far-off theoretical policy paper. Schools in Georgia are in the thick of this right this very second.
The timing makes this deep dive incredibly relevant. But we should explain what that mandate actually entails.
Please do.
HB 268 fundamentally requires schools to elevate their mental health infrastructure. It mandates concrete safety plans, threat assessments, and integrated mental health resources.
So they can't just ignore it.
No, schools can no longer just say, we care about mental health. They are legally required to have an operational apparatus in place to handle it.
But whenever you talk about bringing healthcare into a public school system, you hit two massive, historically immovable brick walls: privacy and money.
Oh, absolutely.
Let's tackle privacy first. How does MentalSpace actually overcome the access barrier without violating federal law?
They handle the privacy barrier by being fully HIPAA and FERPA compliant.
Okay, let's unpack those acronyms because that intersection is a legal nightmare for schools.
It really is.
Yeah.
HIPAA, as most people know, is the federal law protecting your medical privacy. Your medical records cannot be shared without consent.
Right.
FERPA is the federal law protecting a student's educational records. Parents generally have the right to access FERPA records, but a teenager might have HIPAA rights to keep their therapy notes private.
Wow. That is messy.
Extremely. When a therapist operates inside a school building, which law wins? It is an administrative maze that usually scares schools away from providing care altogether.
Because nobody wants a lawsuit.
Exactly. MentalSpace solves this by managing the compliance backend entirely. They ensure that medical records stay siloed from academic records, keeping the school legally safe while getting the kid care.
That is a massive operational hurdle cleared. But then there is the financial barrier. I mean, therapy is incredibly expensive.
This is where they've truly innovated. For Medicaid patients, the cost of this care is $0.
$0. Let's not gloss over that. That is life-changing for lower-income families who usually get entirely priced out of mental health care.
Absolutely. The financial barrier is often the hardest stop for families in distress. But they don't stop at Medicaid. They accept a sweeping range of private insurance. Rather than just listing out the providers, it is important to understand the scale here. The sources show they have integrated with the state's largest Medicaid managers, like Peach State, CareSource, and AmeriGroup.
Okay.
Right alongside massive commercial carriers like Blue Cross Blue Shield, Cigna, Aetna, UHC, and Humana.
They have effectively blanketed the market. They've stripped away the financial friction that usually stops parents from getting their kids help.
They have removed the excuse.
Yeah, they've made it so a principal can sit down with a parent and say, your child is struggling, here is the dedicated team, and no, you don't have to navigate a billing nightmare or pay out of pocket to use it.
This raises an important question, though. We can build all the digital infrastructure in the world. We can solve the high pay and FERPA compliance, and we can mandate it by law. But how do we actually measure success in mental health?
Right. Because mental health often feels highly subjective.
Yes. How do we know this massive systemic investment is actually working?
You can't just ask, are the kids happier? I mean, that is not a measurable metric for a state budget.
Exactly. But the sources provide hard, quantifiable data on the outcomes of the MentalSpace program. And the numbers are staggering. The most critical metric they report is an 89% improvement in attendance among the students treated.
Wait, let's just pause on that. An 89% improvement in attendance.
It is massive.
We were talking earlier about kids literally refusing to go to school because of the severity of their adjustment stress. What this data shows is that when you actually treat the root cause, the emotional shock of the transition, they physically show up.
They show up because they finally feel equipped to handle the environment. The therapy rewires that paralyzing fear.
That is incredible.
The data also shows a 92% reduced anxiety rate among the students treated. And looking back at that whole ecosystem approach we discussed, they boast an 85% family satisfaction rate.
That is the proof of the fish tank analogy right there. You treat the kid, you support the family at home, you relieve the teachers who are managing the classroom, and suddenly the entire school ecosystem functions better. It is not just a nice thing to do, it makes the school operationally superior.
It is a clear demonstration of cause and effect. Unmanaged adjustment stress leads directly to absenteeism and anxiety. Culturally responsive, immediately accessible therapy leads directly to attendance and stability.
So, what does this all mean for you, the listener, whether you are a parent, an educator, or just someone trying to understand the modern educational landscape? I think it boils down to a very tight, empowering summary.
I agree.
Transitions in a young person's life are incredibly hard. Upending a kid's ecosystem hurts, and adjustment responses are a real clinical reality, not a behavioral flaw to be punished.
Exactly.
But the most important takeaway from these sources is that no child, no parent, no teacher has to wait it out alone in the dark anymore. Systems like MentalSpace are fundamentally changing how schools handle mental health, moving us away from an outdated culture of tough it out and into a culture of immediate, comprehensive, systemic support.
The clinical tools exist, the legal pathways have been cleared, and they are being deployed at scale right now.
If you are hearing this and you want to learn more about how this is working mechanically, or if you need to look into this for your own school ecosystem, the sources provided their direct contact info. You can find them at mentalspaceschool.com, or you can reach out directly via email at mentalspaceschool@cheektherapy.com.
Looking at all of this, the sheer scale of the same-day teletherapy, the integration of family counseling, the focus on staff wellness, it leaves me with a lingering question for us to think about.
What's that?
If adjustment stress and youth mental health challenges are so severe that schools are now required by law to provide all these clinical interventions just to achieve high attendance, does our fundamental definition of a school need to evolve?
Oh, wow.
Are schools no longer just places of academic learning, but actually the primary health and wellness hubs of our modern communities?
That is exactly the reality we are walking into. We cannot just expect a child to learn algebra if their nervous system is in crisis. We have to tend to the whole ecosystem. Thanks for joining us on this deep dive.